Microscopic test.
10K. 1K.
A.
5 minutes.
It's
A. 5 minutes.
5 minutes into 1.5
minutes.
RPM.
1500 RPM. So
Yeah.
so you know all the answer. I'm just trying to refresh you guys.
Yes.
Which is the common lab disinfectant?
Bleach.
Bleach, hypochlorite, 1% hypochlorite.
You have to give the percentage. There is no
Yeah.
option about the bleach. Is there any option in bleach?
Oh no.
No.
1% hypochlorite.
You have to give the
C.
right exam. Yeah.
C.
All of these are safety acronyms except
Letter B.
V.
FOB. What is FOB means?
Fecal occult blood.
Blood test.
Blood
Okay.
test.
Okay. Okay. So I'm not going every one of them, just so clearly. What is not an example of pre-analytical quality control in the laboratory? Checking blood tube expiry dates, unpacking receipt supplies by putting new stock behind the old, running 3 levels of QC prior. Okay, so that is the analytical phase. Okay, good. Take the
Yeah.
pre-user represent. Okay, so it looks like easy for you guys. Everybody, I just hearing couple of voices. Do you think everybody has the same boat? If you cannot, you have to think about the questions and you can find it out answer. What
Yep.
chemical urinalysis result will be positive with a gram-negative urinary tract infection?
Letter
The
A.
nitrites. You
Nitrites.
tested the nitrites.
Letter D.
Besides in
Gram negative.
A.
yeah, A.
It's
Because
A.
of
You
the
also the
nitrite.
nitrites.
A, I think. It's A.
Are we
Yeah,
right?
this is the same question before.
I'm leaving you on you guys.
Nitrite
MLT
and
has
blood.
asked to prepare.
Nitrite and blood, because leukocyte is
D.
positive.
That's what I'm saying.
Oh yeah,
That's gram
nitrites
positive
and
for
blood.
leukocyte.
Yeah.
Yeah.
So nitrite and blood.
Okay, so this is another thing how we are going to do the preparation of the solution. This is an example. 5%, 50 ml of 5% V by V, weight by volume calcium chloride. Distilled water as solvent. How much you have to do? How much calcium chloride needed to weigh out for this reagent for making the 50 ml? Anyone can answer that one?
Is this 250?
What is the concentration? 5%. What is 5% means?
5 over 100.
It's 100.
The last 2.5.
Yeah, 5 over 100.
5 over
Yes.
100.
Yes,
Okay,
answer
so you
is
have to make 50 ml.
2.5.
So what is going to be that? What is going to be the answer?
2.50 grams.
2.5 grams.
2.5 grams. So who is telling
Yeah.
250 gram? Who told 250 gram?
No, it's in the thing, Mom. In the letter D.
It's D. 2.5.
Yeah. So you can
Yes,
understand.
D.
Now I hear
2.5.
somebody tell 250 gram. That's why I'm just asking. Who has the concept of 250 gram? Think about that. It may not be the same. I just giving an example. It may not be the same value, same question. It may be different component. It may be V by V, or it may be more different concentration. Just try to flash you back. This is the thing you have to make the solution things. When a molecules move from a region from high concentration to the region of low concentration through a semi-permeable membrane,
It's osmosis.
Osmosis.
anything when there is a involvement of
Osmosis.
semi-permeable membrane is osmosis.
Osmosis.
Gross examination of tissues in the histology department is referring to the
Tissue.
Tissue section.
It's
Macroscopic
macroscopic
examination.
examination.
Macroscopic.
Gross
What?
examination of tissue in.
Gross examination, ma'am, is macroscopic.
Macroscopic examination.
macroscopic examination. You are just seeing without the eye, seeing the what type of tissue, everything is that. You have to chop it or something like that. That is the macroscopic examination. Okay. What is an example of an active and natural form of immunity?
Breastfeeding.
So
You receive
Active is
active from the
vaccination,
breast.
and natural is from the mom, breastfeeding, yes. Receiving gamma globulin, bacterial, natural. Usually that's maternal, mom.
Getting a
Maternal form of immunity.
vaccination.
That is the natural immunity, right? Yeah. Okay.
Yes, ma'am.
So what do collect? Why do collected microbial specific and you transport media for transport to the lab for being testing?
Letter B, to prevent cross contamination.
C, to prolong the survival of the
yes.
microorganism.
Exactly,
See.
exactly.
Yes,
Cross
letter C.
contamination. You once the sample is inside, there will be a chance of there is no cross contamination inside. They are outside, maybe contaminated. You have to take care of that, the bottle and this and that before and after. Okay. Okay, patient's room that you have collected on before, but they say do not want to go through. Who is the blood collection? What is your next step?
Letter C.
Respect their decision. Tell the
Yes.
ward nurse as you
C.
live. C.
Yes. Okay. Yeah. Good. What is the symbol?
Biohazard
Biohazard infectious
So this is I
material.
gave an example. Okay. So all
Yes,
the
ma'am.
symbols, what is flammable, inflammable, oxidizing, cancer, all the WHIM symbols.
That's
Keep it in
A.
mind.
Violet.
No,
Yeah.
this one I just said this one as an example.
Okay,
Yes,
They
ma'am.
can give any symbol,
that's
like
right.
the what is the signal, what is the danger. There are different types of symbols, right? Any symbols may come there. Okay. So
Yeah.
this is I said is an example. Biohazard. If I give the
Yes, ma'am.
flammable, what is the oxidizing symbol? What is the toxicity? What is the gas under pressure? So all the symbols, keep it in mind, just remember it, and just any symbols may come with these things. Okay?
Okay, ma'am.
Okay, ma'am.
Okay. Okay. Fixation of histology tissues are dependent on what factors?
It's C.
Type
Type and
and
size.
Type and size.
Type
Good.
and size.
Okay.
Yeah.
Standard electrocardiogram test consists of how many leads?
10 leads and
12.
12
10
electrodes.
10 leads, 12.
And 10
Or
electrodes.
sorry, 12 leads, 10 electrodes.
And 10 electrodes. Yes.
12
12 leads, 10 electrodes.
12
So
leads,
answer
10
D.
electrodes.
12,
Yeah.
10.
Okay. So
12
that's
leads,
the
10
D. Good.
electrodes.
Okay. Which condition is characterized by the yellow discoloration of the skin caused by the excessive bilirubin in the blood?
Jaundice.
Jaundice.
Everybody
Jaundice.
knows that.
Jaundice.
That is a very stupid question. I didn't. Physician requested a blood culture collection set on an elderly patient. The previous phlebotomist noted the patient veins collapse very easily. What is the best collection technique to use for this patient?
Letter C.
Syringe method.
Syringe.
Range.
This is for a blood
that's
culture.
blood
So
culture.
letter D.
Letter D, yeah.
Yeah. It's the only butterfly.
This one, butterfly.
Yes,
Small,
ma'am,
This is the yeah.
Yeah.
23 is the smallest one, and then you are going to use the butterfly. Yeah,
Yes.
yeah.
ma'am.
D is the right answer. Okay. What is the important quality control element with regards to laboratory inventory?
The newest one will be at the back.
Yeah, so this is not the right one.
Yeah.
Yeah. For easy.
Yes. Please. No, that's wrong.
Tell me which is going to be the answer.
The newest place in
C.
the back and the old.
No, it's wrong for the C
It's wrong.
because it says
It's
newest
wrong.
product is placed
Yeah.
in front.
The newest should be placed in the back and the old.
It would be letter A. Cytotoxic. Is it cytotoxic?
Specific
Time.
station that says as temperature. No, letter A. I would say
Letter A.
letter A.
Write your
Write your
initials
initials
in the date and time of
Yeah, intracellular is the T cells.
No, ate, we're on the question before that.
No, for the quality control inventory.
A,
A for me.
like
Yeah.
your initials.
Unless the newest one will be at the back and the older will be at the front, then letter C.
That's right.
But I think it's letter A.
Yeah.
Yeah,
A is the best option here.
that's right.
So what about the specific storage requirements such as temperature and light?
It matters too.
Temperature, that matters too. Yes, ma'am, the temperature will matter.
So when you are doing the inventory, you have to see the what is the temperature, what is the how you are going to store it.
Yeah,
Which immune system component cell can recognize and kill intracellular pathogens?
Letter A.
Neutrophils.
kill intracellular, that's
Okay, think
cytotoxic.
and keep it.
It has to be neutrophils.
Cytotoxic.
Okay,
Cytotoxic.
keep it in. Think about that. Cytotoxic T cells, antibodies, neutrophils, eosinophils.
It's inside.
Write the
Yeah,
question if you cannot. Yeah.
Intracellular.
Okay.
Neutrophils, miss.
Okay.
Yes, ma'am.
You
Yeah.
find the answer.
Yeah.
Which body fluids does routine practice does not apply?
Urine. I'm not sure.
Does
Sweat.
not apply.
Sweat.
Sweat.
Sweat does not apply. Sweat.
That's routine practice. Oh, yeah, that's sweat. Or maybe
did-
seminal. I don't know. I'll have to
No,
read
you
that
need
to
a-
other one. Or I'm new.
Yeah.
You need
The
a-
question?
A D-dimer. The question is which body fluid does routine practices not
Not
apply?
apply.
A
Yes,
D-dimer
yes.
add on the test has been received from a physician on a newly collected specimen. You check the LIS and see that tubes are collected for liver panel and complete blood count test. Which tube you can use for add-on?
Neither.
Neither.
Because it should
Neither
be a
tube.
light
You should the
blue.
light
Neither
blue.
tube.
Yeah.
Good.
It's a
Sodium
They have
yeah, light
collected
blue.
or they have collected only the liver panel, either mint or SST and the lavender, right? They didn't
Yes.
collect any blue. If they collect blue before, you can add it on. So you cannot add on anything. You have to redraw it, freshly drawn. MLT is collecting on a difficult patient in a hospital ward. Their first attempt misses the vein. What is the next postural step allowed?
Letter C.
Yes, if they can try
Yeah,
for
they
a second
can try
collection
second
because you have the
collection.
two options, right? Yes.
Yeah.
What three enzymes are useful in diagnosis of liver disease? It has been told before, so you guys can find it out.
Yeah.
Okay.
Yeah.
Letter.
Okay. So yeah,
C.
liver disease. Yeah.
Letter
So,
G.
oh no, this should
Letter
be
C.
C, D. Yeah, so
Yeah,
that's my
it was C.
problem. Okay. So
Letter
these are already
C.
learned. These are already in your questions, answers. Everything has given. What is the most effective way to prevent the spread of infection?
B, wash your hands.
Wash your
often.
hands.
Often.
Yeah.
Wash your hands.
Washing hands.
Yeah.
Mhm. Which of the following items can be found in a clinical laboratory refrigerator? Employees lunch, parafilm, thermometer, glucose drink for GTT.
I
Letter
think
D.
glucose drink.
D.
Yeah.
Letter D.
Okay.
Glucose. Yeah.
So, okay. What is the possible cause of hemolysis in a collected blood tube?
Mm,
Even
A.
C.
Using
Middle.
a needle that is too small.
What is this?
Too small. Needle that is too
Yes.
small.
Be using a needle with too
C.
small of a gauge.
C.
It can lyse the blood cells. C.
C, yes.
B.
In the
That's
collected
hemoconcentration.
letter
Oh,
C is
Hemo concentration is
hemoconcentration.
for C.
C is
Yes.
emo. Oh yeah, yeah. The gauge, the needle gauge can lyse the
It looks like B is the best answer.
B. Yeah,
Yes.
the
Yes.
needle.
Yes.
According to the Gaussian, one study refers to
When SD is
B or
60.
The
the
equation.
highest one. I think that was 95% of data. I think it's 95.
One
SD.
SD.
That should be 95, I think.
B.
One
B.
SD.
68.
No.
B.
68%.
68.
One SD
68.
is
68% of
68.
yes.
68%.
One
That
SD
is
is
95, I think.
68%.
Yes.
Two
Yeah.
SD is
68.
95%.
Yeah.
Okay.
Yes, ma'am.
Okay, ma'am.
This
Thank you.
question can come in different way. But you have to remember always what is the one STD means, two STD means, three
Yeah,
STD
Yonisha.
means. Okay.
Yes.
What is the purpose of performing WBC differential? Everybody can know.
Yeah.
C.
Right.
To
Letter
count the
C.
number of all
Letter
white blood
C.
cells in whole blood specimens.
C.
What you got the answer?
C.
C.
It's B.
Said B. I said
B.
B.
The
B.
proportion of
Yeah,
individual
Oh,
WBCs
yes.
in the whole blood.
That's
Yeah.
right. Proportions of WBC. Yeah.
What level of risk group hazards are common in hospital medical laboratories?
2.
Level 2 and
4.
I would say C.
C.
2 and
2 and
3.
3. Yes.
Okay, you guys decide. Incubation is an anaerobic environment. Is required for which of the following specimen?
For anaerobic, brain abscess.
Find it out. I am not going to give any answer today. I just giving you the example of the questions.
Yes.
What do you mean by sanitization?
I would say
Letter
C.
D.
Oh, sorry, sanitize.
Disinfected
Sorry,
with hypochlorite.
disinfected.
Chain of
B.
gross contamination.
It's B.
Cleaning
Letter
of gross
D.
contamination is
D.
sanitization.
Yes.
Disinfection is with hypochlorite.
Mhm.
Antiseptic cleaning skin is 70% alcohol or providing or chlorhexidine.
Yes.
Till now that sanitization, disinfection and antiseptic cleaning is not till in the brain. Still getting confusion. Still getting confusion. How much I tell, how much I yell is going to be the same position in the brain. My goodness.
Yeah. Okay.
What is the most critical step in gram stain?
Decolorize.
Decolorizer.
Okay.
Yeah.
Hypothyroidism, T3 and T4 analyte values are
Lower the number.
Higher than
Lower the number. Lower than normal.
Lower,
okay.
lower. Hypo.
Okay.
A.
Okay. Okay. What term is used when a solution has a solute concentration equal to the inside of the cell?
Isotonic.
Isotonic.
ISO.
That's A.
Iso means equal, right? Outside and inside and same.
Yes.
Okay.
Letter D.
What disease?
Yeah.
Yes.
11.
Yeah.
Which disease or disorder is caused by a decreased stoppage of blood flow to a portion of the
Myocardial
myocardium?
Infarction. That should be infarction. Myocardial infarction.
Myocardial.
B.
Letter B.
Myocardial.
B and B.
Yes.
Exactly. All are
B.
other different types of disease, myocardial infection, artery disease, congestive heart failure. But this is myocardial infection, though this is stoppage of blood flow. Okay. WHIMIS stand for
Workplace hazardous
Workplace
materials.
D.
hazardous
Information.
materials.
C.
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 That's C.
Yep.
everybody?
Yes.
Yes.
Everybody?
Yes.
Sure?
Mhm.
Sure?
C.
Sure?
Yes.
Let us see.
Sure? Raise your voice. Yes or no?
Yes, ma'am.
Yes.
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 Okay. Which term
Yes.
describes the inflammation bone and bone marrow?
That is C.
C.
This is
C.
osteomyelitis.
No, I would say
Myelitis.
because if you say Maya, I'm not seeing anything muscular there. So I'll say osteochondritis.
D.
Chondritis.
Myo. It should be
Maya
Osteomyelitis.
has to do. Oh yeah.
Yeah.
Maya, yes, that's bone marrow.
Myelitis.
That's C.
Yes.
C.
Bone
C.
marrow is MEY.
Yeah.
So that's C.
Yeah.
Osteomyelitis.
So bone is osteo, bone marrow is Maya. Itis is the inflammation. So
That's
yes,
right.
C.
Yeah.
C. Yes.
Okay.
Mhm.
Okay. Before a phlebotomist collects blood on an ambulatory patient, they mention that they fainted at the collection. What should be the collector do?
A.
Lying on the bed.
Oh,
Get the patient to the bed. B.
Yeah.
B.
B.
Okay.
B.
Okay.
Yeah.
Oh, Asnath is so fast. Good.
Mhm.
What is the most important step in specimen collection?
Identification. of the patient.
Identifying the
Identification.
patient. D.
C. D. Patient identification.
What is appropriate to use routine practices and additional precaution?
When dealing with
When dealing with
D.
biohazardous.
Biohazardous specimen.
biological person. Well, there are more than one.
The routine practice is the letter D.
When dealing with
Biohazardous
biohazardous
specimen.
specimens.
Yeah.
D.
to
D.
avoid
What is the name
getting
of the
infected.
junction between two neurons?
Synapse.
The synapse.
A.
Synapse.
C.
That's a
C.
synapse.
C.
Synapse.
A.
Give me the
A.
option A.
Yeah.
Okay.
A.
Yeah. Oh, sorry.
HPV infection can lead to which of the following disorders?
B.
Sterility,
Cervical
cervical
cancer.
cancer,
Cervical
ovarian
cancer.
cancer.
Cervical
A.
cancer.
Okay. What two components make up the Romanowski stain?
B.
Letter C.
Eosin and methylene blue.
Yeah.
C.
A.
Okay.
Letter
What is
C.
what is the
Oh,
base
sorry, ma'am.
definition?
Romanowski, ma'am, you said? It's a supervital, so new methylene blue.
Yeah. C.
It's methylene
Eosin
blue,
and
not
methylene.
new methylene blue.
No.
New
Romanowski.
methylene blue is for reticulocyte stain.
Yes.
For oh, yeah, that's supervital, sorry. Yeah.
For immature erythrocytes.
Yeah, letter C.
What is the best definition of differential media?
It permits the growth of some and
Yes, inhibits the
one
others.
type of bacteria, so that's letter C, ma'am.
Mm-hmm.
Promotes the growth, but inhibits the other.
In class. Bye.
The test on the
That's
hematology
calculated.
analyzer determines the number of immature RBCs. Immature
Reticulocyte
RBCs
count.
in a
Letter
whole
B.
blood. Emmanuel
new
cannot
methylene
confirm the
blue stain.
slide stained with
New methylene blue stain.
Reticulocyte count.
Reticulocyte count.
And blue stain.
That's
this
B.
one lithium B.
Yes,
This is immature blood cells,
that's
right?
right.
New
Yeah.
blood cells. Good.
It's letter B.
Patient has a random glucose level of 9.8 millimole per liter. What does this indicate?
A. They need to be checked for diabetes.
Yep.
A
Yes,
random blood of 9. That falls within the range.
Within the range.
D.
That should be within the range. I think
Nine
the range is
9.8
11
millimole is within the
9
range.
is not
Yes,
within the
ma'am.
range.
for random.
For random,
Not
it's in
fasting.
the range.
Kara
It's
is random.
11.
No, 9.8 is still high.
Still
D.
high. Random is
Yes, ma'am.
It's a
Go
random
for
fasting. It's a
fasting.
random blood sugar, not a fasting blood
Yeah.
sugar.
That's
It
a
doesn't
blood
matter.
test.
They still need to be checked for
It's still
diabetes.
high.
9.8
Yeah,
is
that
ridiculous.
9.8 for
Yeah,
random
but
is still
it's still
high.
within the range. It can be high,
D.
but maybe high
Is it
in
D?
the
Random,
range.
it's still in the
Yeah,
range.
getting
No, not
close to the
gestational.
edge.
Gestational diabetes is
It's
different.
A.
So A, you check the
Yeah.
patient.
A.
Yes.
A requisition has a CBC, PTT, and electrolytes order. What is the correct order of draw?
D.
That's light blue.
A. Light
A.
A.
Light blue.
A, light blue.
Lithium,
Heparin.
heparin, and EDTA.
And ADT.
Somebody told D. Who told D?
A is the right one.
Who
Light
told
blue.
D? Who told D? Can confess? Can anyone confess who told D?
I think
Me.
Vinas.
Who is that?
Me, Binesh.
Venus, you have to be little bit extra careful, okay? No, I am not telling you, I am not doing anything, but this is very important. No, you told me that you are still feeling difficulties in understanding, but when there is a PTT or INR light blue, that should go first, okay? Whatever is there, light blue. And then after that, either SST, which is the serum separated tube, which is the yellow one, and then you have to run the lithium heparin, that is the mint color. Okay, and then you are going to the lavender. These 4 tubes are very important. So light blue, then gold or yellow, then light mint or mint color, and then the lavender. This is the every day you are using it. Okay, so this is going to be the order of draw. Thank you, Minas. I really appreciate that you came for our tale, so I can help you. It's not that okay, I like to point it out, but if I know, and if you still have any problem, always you guys can discuss with me. Your creatinine clearance test is done on
D.
Blood
It's
sample.
the last one.
24-hour urine sample.
The last one.
Yeah, last one.
what is not a determinant of health in Canada?
D, portability.
Portability. Okay, a requisition has an electrolyte panel, complete blood count, and PTN order. This is I am asking Venus. Nobody answered. Venus, you try. What is the correct tubes used and order of draw? So we have PTINR, Venus. We have complete blood count. First of all, you tell me for the complete blood count, which tube color you are going to take?
EDT,
EDT. What is the color?
purple, lavender color.
Lavender. Okay. And then PTINR, which tube you are going to collect?
PTMR. I think it's lavender too.
Try.
SST.
No. PTINR. PTINR is all coagulation related. Okay. PT, APTT, INR, all these are blood coagulation related. This has to be drawn in light blue color. Write it your note, okay? PT, APTT, INR, this you already learned from Badil. So I think probably you forgot that. So PT, APTT, INR, D dimer, okay? Write it your note. These are all going to draw in the light blue color tube, which has the sodium citrate anticoagulant. And I'm going to little bit further because that question also come. What is the ratio between anticoagulant to blood? 1:9. Okay, so write it down, Venus, and who has any problem, you guys can write it down. So anyway, when there is a PT or INR, you have to draw it in the light blue color. First, seeing the question, you have to see what I have to draw. I have to draw complete blood count, lavender, for PT INR, light blue, and they have ordered another one, electrolyte panel. Electrolyte panel can be done either in which color, Venus? Right? Electrolyte panel can be drawn in which tube? Which color tube?
SST, I think.
You can draw in the SST mostly. You can also, if there is no SST option, there is a mint option, you can use this one. But in this question, you can hide. You have now, you as per the question, you have to draw one light blue, right? Which is the sodium citrate. Then you have to draw electrolyte, that is the serum separator tube. So you can use the SST or PST, and you have to do the lavender, right? So what is here the best choice here? Because you have to do the light blue first. See, this is very clearly, this is sodium citrate. Because you are going to be, majority of you are going to confuse this one, light blue. But this is not the right answer because you have to do the SST. Serum separator tube is going to be after the INR. or the light blue tube or the sodium citrate tube. What type of anticoagulant is there, Venus, in the SST tube? Is there any anticoagulant?
No.
No. You had the anti-clot activator gel. So that it separates the serum. So what is the best answer here?
Ebota.
You have to do the light blue. Hello. Hello.
Yes,
Hello,
ma'am.
sweethearts. You like to? Okay. So then you have to write the light blue, and then you have to do the serum separator tube first, or the plasma separator if you doesn't have the serum separator, SST or PST, and then you are going to move to the lavender for the complete blood count. So this is the best option. Did you understand a little bit, Venus?
Yes, ma'am.
Okay, write it down. Okay. Which infection can be transmitted sexually?
A.
Hepatitis
A and
B.
B should be because they are both viral infections.
Yes, empirical strep throat, but mostly hepatitis A.
1 second.
Okay,
I have a
according to
question. Sorry,
according-
Grace was on the group chat. She wants someone to send her a link. I'm not sure how to do that. So if anyone knows
I
how to
sent
send
her an invite. Did it not work? I'll send her another.
Okay, thank you.
No worries.
according to CLSI, what is the correct order of vein choice when collecting the blood from an arm?
Median first.
Yeah, cephalic
Cephalic
bacilli.
and basilic.
Okay, so this is the number B. Okay, so
Yeah.
you know that. What is not a benefit to point care of testing?
Letter D.
No
quality
control
No
required.
quality control required. Though it said in needed. Okay. The hormone that directly increases the reabsorption of water by the kidney is
PDA.
Diuretic hormone.
ADH, no?
ADH.
PDA.
ADH.
okay. What are freshly made cytology smears commonly fixed with?
25%
85% ethanol.
25%
Mhm.
ethanol.
Just did it, right?
Yeah.
How
Cytosol,
histology
yes.
blocks field?
Yeah.
specimen.
Not
type.
field, filed. Sorry, filed.
Surgical number.
Number.
Surgical number.
You sure? Not by patient
Yes.
name?
Yes, it's
Everyone?
surgical number.
Everyone?
Yeah,
Not very
surgical.
What
well.
is the another name of the surgical number?
Did you call it?
Accession.
Accession number.
Accession
Somebody put the
number.
accession number, somebody put the
Yeah.
surgical number.
Yeah.
It depends
accession
upon
number.
hospital to hospital or yeah. Accession number means the number. It can be anything, whatever is the rule, but accession number, the number through which you can access. That is the accession number. If the following terms indicates the highest purity of chemical.
Analytical
C.
reagent grade.
Letter C.
Analytical grade. A timed phlebotomy test request has come into the lab for a digoxin level at 1300. What is 1300 means?
1 o'clock.
1 p.m.
1
1
o'clock what?
PM.
1 p.m.
1
PM.
PM. Afternoon.
Sorry, PM.
Yes, when an MLT asks the patient the last time of the digoxin dose, the patient responds 1 hour ago. Sorry. What level of therapeutic drug testing is being monitored by the physician? Trot level, time level, efficacy level, peak level. You already
Dila
learned this
peak.
one.
I think throw level.
Yeah.
I am not answering
It's
this
already
question.
reducing.
It's already in there. Okay, so yeah, just check your answers. I'm just giving a couple of hints.
Yes, ma'am.
In an electrocardiogram, the QRS in V1 expect to deflect in which direction?
Positive upwards, right?
Look at the ECG chart and find it out. The V1 in QRS, whether it's going to positive deflection or negative deflection. Check that one. Write it down, note.
Positive.
Yes,
Which of the following steps in the accurate of setting up a throat specimen in the microbiology? accurate setting up for include BAP and BAP bath, include swab into blood agar plate and place them into place BAP, chocolate, MAC and incubate, prepare a direct smear of the gun stain after including MAC and chalk plate. Okay. Okay, so make sure about the throat specimen setup.
Yes, ma'am.
Okay. After cutting the tissue on the microtongue and placing it on the slide, what is an important step before staining?
Clear wax using saline. Letter B.
What is depth skin solution? Dangerous. It contains what?
Cyanide.
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 What is the following base defines as a bill? You can write about the bill. What is bill? Okay. But you have brand ethics, so bill. Body's response to trauma and the introduction of foreign pathogens called?
Response to trauma, foreign pathogen, infection, I would say.
Infection.
Yeah, A.
So it says in the solution. Which?
Solute is the solvent.
Dissolving.
Solvent is the water.
Okay, so that is the now A.
Solute and yes, ma'am.
Solute in
Solute.
solvent.
And then
What is the best time to NMS scar on a neonatal using a capillary heel puncture?
24.
24 to 48. But it says 24 to 72.
yeah, B.
Supposed to be 48 hours.
That's right. 48
But it's a
hours.
range. 24 to 70. I know it's supposed to be 48, but yeah, it's a range. That's the
It's B.
closest one there.
What is the best answer you will give? Okay.
B.
Yes,
Yeah.
ma'am.
What is the accurate representation of? What is the accurate representation of 5 minutes past midnight using
A.
24-hour? Okay.
0005.
A.
Okay.
Yes.
Okay.
Mhm.
How much of 5%? This is also do the calculation. 5% solution of hydrochloric acid will be required to make 500 ml of 1% solution. So you can what? W1V1, W1V2 formula. Okay. Right? Okay. What type of microorganism needs oxygen to grow?
Obligate aerobes.
aerobe.
Okay. Indicator means?
Strong. It gives different colors
I think it's B.
in solution.
B.
A strong acid or
B.
base which exhibits different colors in solution.
B, I think. It's B.
Iodized from him. Physician has requested a urine culture and sensitivity on their patient. Which patient collection procedure would you provide to the patient?
A.
C.
C.
C. Clean catch
On the
mystery.
patient, which patient procedure? Yeah, clean catch mystery
Clean
urine
cut.
instructions.
Midstream.
Yeah, during the phlebotomy procedure, MLT spoke with the contaminated patient needle. Held as a route of entry is the best type as?
Injection.
Injection.
Okay, good. As of July 21st, the Ontario Ministry of Health announced a new regulation for the Laboratory Exercises Act that replaced with the previous two regulation.
682.
Yeah, A. Specimen Collection Center Laboratories and Regulation 682.
What is allowed to order a laboratory test?
Midwife.
Midwives.
Yeah. Who is allowed? Only the midwives. Yes, that's the question has been done long before. Okay, so good. While performing daily temperature checks, the MLT notices that the chemistry feed is out of temperature range. What is the next procedural step?
D.
All over the
That's
laboratory
A.
members.
I think A.
D.
It could have been
Overrate and
opened
leave it.
previously.
Yes, letter A.
So the
Yes.
temperature
Yeah.
would
Check
have
the
dropped. So
temperature.
you can come back to check. If
Yeah.
it is still low, then there's a problem.
That's right.
Yep. Okay. When diluting acids or bases with water,
Always mix water
Acid
with
to
acid.
water.
Acid to
Acid
water.
Acid
Acid
or
to
just to water.
D.
Acid to water.
D.
D.
which bone tissue functions at a fat storage area?
A.
A
Yellow.
yellow
bone.
bone marrow.
Yellow. Yeah.
When is it okay for a lab personnel to not wear gloves during their shift?
They pick up their phones. Is it there?
Insert the
When
phone.
they're using the phone.
Or in the
It's
lunchroom
not
while
there.
on break.
Yeah.
Lunch
Yeah.
break.
Letter A.
So it's in the
A.
In the
lunchroom.
Yes.
In the
lunchroom while
lunchroom.
on
Yes,
break.
lunchroom, yes. Haha. That everybody knows, right? Yes. Who is responsible for preparing MSDS or further hazardous substances used in the workplace?
Suppliers.
Supplier.
Supplier.
In the workplace.
Manufacturer.
Yeah, supplier.
Worker.
In the
Or
workplace.
workplace
Okay, in the
employer.
workplace, the employee,
Employer.
employer,
Employer.
employer.
Yeah.
What is the most common stain used in the histology department?
Hematoxylin.
Hematoxylin. Hematoxylin and eosin.
B.
The
pH.
negative log of hydrogen ion concentration is known as
pH.
pH.
the normal reference range for sodium in SI units.
Letter A.
Letter A.
A. 35 to
145.
185.
Good, good. Okay, so for accurate measurement, a volumetric pipette should be viewed.
At
At
eye level.
Eye level.
Eye level.
A.
A.
Where?
At eye level.
Eye level.
Okay. Okay. What is the purpose of anchoring a vein?
To stop the vein
Stop
from
the vein
moving.
from moving and rolling.
Stop the vein from moving and rolling.
Yeah.
Mm-hmm.
Vein from moving and rolling.
Mm-hmm. Standard deviation is a statistical term that
See?
C expresses the amount of variation
Yeah. The
around a mean value.
variation to the main
C.
value. Letter C, ma'am.
yes, like to see whether others just staying there, not responding, or what is saying. I see just only couple of people are very nicely, professionally, they are
Yeah,
answering.
standard variation has to do with the variability of this data set.
Inghong, no voice. Mary says no voice.
Yes, ma'am.
Why?
I always answer.
I'm here.
You do? Okay, raise
yes,
your
ma'am.
voice.
I
Don't be
always
shy.
answer.
Chenaida, Fasado, Joanna, Chris, Santiago, I hear voice. Luis rarely. Yusra, Alexia. How you doesn't know some of them? You are just Huda. Where are you? Huda?
I'm
You
here,
are
Miss.
not getting. Huh?
I'm here.
Huda.
I'm here, Miss. Yeah, I'm here.
I am not hearing your voice too. I don't see you in the video also.
Answered a couple, but I will speak up more.
Okay, please. Otherwise, and Luis, if you take so much time to think about what you are going to do tomorrow exam, and I like to hear from everyone. Joanna, Fazado, I know you guys know the answer. Chris, answer. Alexia, Jenaida, Yusra, raise your
I do
voice.
answer sometime.
Be louder. I cannot see always. Okay, so just like that. Inghong. Okay. So
Yes,
then I will
ma'am.
understand everybody knows the answer, not like that. Okay. 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 What is the term best fits the following definition?
And Z.
Sorry, which one? Standard deviation.
Where's the definition,
C
ma'am?
expresses the amount of variation
C.
around a mean
Mm.
value.
Mm.
C.
Okay.
Definition of what?
Where's the definition? You said what time best fits the following definition.
Yeah, I'm a little lost too.
I am little
Yeah,
lost
so we
too.
need to see the definition. Yeah,
Yeah, 'cause I don't
there's no
see the
definition.
Yeah.
Right.
Yeah. Yeah.
Yeah.
I mean, from all of
It's
those ones,
probably,
I think the best one is C.
But there's no definition. There's nothing.
Yeah, there is no definition.
Maybe she's looking at the previous question.
Yeah, I'm talking about the other one, the question that said
Yes, it
standard
has been
deviation is a statistical term.
Yeah, I think
we
the letter
answered
C is
that.
the
It's the
definition.
next
This one
yeah.
is C. Chemical
No, that's the
reaction.
same thing.
It's true.
What term is this term?
E.
This is B, septic
Yeah,
technique.
Oh,
so
this
that's
bacteria sterilization.
Sterilization.
E. Yeah.
Destroying all
I knew that's
bacteria
what it was
spores.
gonna
That
be.
is sterilization.
Because it includes the spores.
No, D. It's kill all.
Rogan.
Yeah. B.
This
A
one is
pigment as
B.
a blood
Rogan.
group of A and negative, what product would you like to? Yes,
B.
Rogan. Rogan.
Rogan.
What is the terminology used to describe the formation of a blood clot?
Thrombosis.
Thrombosis.
D.
T.
What are thrombocytes?
Thrombocytes are
They're
platelets.
also an
Platelets.
abnormal
These are
blood-
platelets.
What is fibrinogenolysis?
Breakdown of the fibrinogen
Breakdown of the
after
pregnant.
blood
Oxygen.
clotting. When the thing is healing, so it needs to be broken down. The activation.
What is lysis
clotting.
mean?
Breakdown.
Breakdown.
Section.
So when healing is done, breakdowns of the clot or the mass, that is called the fibrinogenesis. When that the scar tissue is slowly getting breakdown, is due to by the fibrinogenesis.
I think that's when you see the scab formation.
Yeah. So if phlebotomist does not complete the proper patient identification before collecting the blood sample, this is an example of what type of error?
B. Pre-analytical error.
What is the wavelength of UV light?
Below 380.
Below 380.
And what is the wavelength of what is called?
Above 700, ma'am.
The red-
Infrared.
No.
Yeah, infrared.
Infrared. Yes, infrared
Above
light.
700.
Yeah, above 700.
And what is the visible light range?
400 to 700.
400.
Right.
700.
About 400.
Good. What is the best description of precipitation?
Formation of insoluble.
Formation of insoluble particles in a solution.
Good. What is the accurate morphological characteristics of a mature erythrocyte?
No nucleus
There's no
and
nucleus.
the biconcave.
Biconcave shape.
Sorry.
Not sure.
So
I'm
what
not
is
saying
going to
that.
be the best answer?
Letter C.
It is concave.
Concave, it should be
Sure, it is.
biconcave.
It should be biconcave.
Okay, maybe C.
Annotated and concave.
Yeah, that is the best answer we can
The
see.
best answer, letter C.
Yeah.
Okay, C.
Which tissue specimen will need to undergo decalcification prior to the tissue
Bone
processing?
tissue.
Bone tissue.
Bone
B.
tissue.
Okay.
Bone.
What was that? Can someone even is Rugia to become able to join or no? No, till one is missing. Who is missing? Rugiato?
Cristiana and
Christi-
Beato.
No, there will be one. Yeah, Kara is here.
No, she managed to get it.
Christiana and
And
Rugiato.
Rugiato.
Christiana and Rugiato.
I invited Rugiato a handful of times. I don't know if her account isn't working.
I don't know.
or
Is
what's
her
happening.
account is working because she did the test, so her account is working. Yeah, and what is Huda send an attachment that everybody looks like okay, so Christiana can join. Christiana, okay, it's not working. She's not taking at all. So when Huda sent a message, then Kara said okay. Even Kara didn't look at that. Kara said okay, then she joined. No. When Guda sent the message, and I told that Fatima told everybody's problem has been solved. So then I was talking here. Then Huda sent a WhatsApp message. Then Kara joined. Christiana probably is not seeing the message at all. Okay, it's not working. It's not working. Nobody is going to tell it's working. You have to go back and forth to see whether it's working or not. And Rugiato is working because she did the test. A patient requests test result from the MLT. Which of the following statements present the appropriate course of action to taken by the MLT?
C.
They request the test
C.
result. Only the physician authorized to give. Yeah. Okay. What are the biological weights for offsite transportation subject to?
A.
PDG, biological, yes. Yeah,
because-
anything. Yeah, anything. Yeah, anything transportation is transportation of dangerous goods. Which of the following blood collection techniques may cause a hematoma?
C.
Leaving the tourniquet removing the tourniquet before the needle is removed, insert the needle through the vein and puncturing. What is the answer?
Letter D.
D, yeah.
Through and
through.
the needle through the vein.
Yeah,
D.
that's G.
Okay, Luis, you know that answer, right? That's why he knows. Oh my God, that's cute. Okay, it happened to me. Otherwise, I will not remember. As it happened to me, I will remember. Otherwise, who cares? Yeah, so that's why, okay. So that's why you remember. Otherwise, you doesn't want to remember, right? While allocating, separating class, that's right. No exam tomorrow. You are not allowed to give the exam tomorrow. No, I will not allow you. No. While allocating or separating plasma from the cells of a span tube, you notice the plasma is yellow-brown color. What is the term used to describe? This is the answer. Good
A.
answer.
A.
Good. Everybody knows that answer.
Yeah.
We give the following. See, if the answers are quite good, but you have to read the questions carefully.
Yes.
Which of the following urine analytes is an indication of a patient experience glomerulonephritis?
Elevated
D.
protein.
Elevated protein.
Elevated protein. That's
Letter
going to
D.
go. Yeah. Increased glucose will give you the induction of diabetes, right?
Yes.
Presence of bilirubin is what is
Late.
called jaundice. Yeah, excess. Which of the following objectives of the microscope are oil immersion objectives?
100x.
100x.
A.
Which one is the lowest magnification?
10K.
4 times.
10 times, ma'am. Oh, but there is 4 times.
4.
4 times.
Okay. Which is the most important step in gum staining? Again,
Decolorizing.
decoloration. Sometimes
Decolorizing.
there's sometimes this question you already have, right?
Differences.
Before.
Yes.
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 So let me.
we just
Sometimes
can
it
have
happen. I do search and then maybe there's some questions are repeating. Yeah. Which of the following factors can give a false sedimentation rate value measured at ESR?
Letter C. Tilted ESR tube.
Yes.
Yes.
Yes. What statement is true regarding vein puncture needles?
Bevel down. No. Inspect the defects before use.
A. It should be inspected before for defects before use.
Yes. A.
A.
Regarding
So how you are going to insert the needle? Bevel up or down?
Up.
Up.
Bevel up.
Okay. Okay. So do I train you to insert the needle slowly or sharp?
quick.
At
Quick.
once. So
Quick.
that they don't feel the
Quick.
pain.
Quick. Yes. And so what is the angle?
30 degrees.
30.
15 to
15
30.
to 30 degrees.
15 to 30 degrees. So this is the
15 to
so
30.
you have to inspect the for the defects for use, whether it's
Yes.
working, whether it's getting attached with the your vacuum and everything. Okay, what immunohematology test is used to detect erythrocytes fetalis HD and HDB NB?
C.
C.
Combs
C.
direct.
Coombs direct.
Yeah.
Direct
So
cause.
HD, yeah,
Hemolytic disease of the newborn, ma'am.
yes. So just what is the answer? You have the answer. The
Yes.
cavity within the kidney that collects urine is
Renal pelvis.
renal.
Renal.
Yes, renal pelvis.
And who collects the urine in the urinary system?
As in the
Who?
at the
Bladder.
end, the bladder.
The
Bladder.
The
Bladder.
bladder.
Yeah,
bladder.
in the urinary system, urinary blood collects the urine. But inside the kidney, that's why I'm just bringing the question. Read the question when it says that who is collecting urine in the urinary genital system, urinary bladder, and when it's collecting the blood inside the kidney, then it's the renal pelvis. Okay. How long are the tissue blocks and stent slides typically kept in the histology department?
4 weeks. A month, right?
Stain slides.
Since
Box
4
and
weeks.
stains.
1 year.
That's a month, 4 weeks.
You
Actually,
recently
it depends.
you recently study that one. You have the answer.
Yeah.
Find it out. There is you are getting confused there. Okay, go to ritual or the exam questions and reviews, you will find it. And MLT is preparing urine for microscopic analysis. After centrifuging the urine, what is the next procedural step?
Pour off the supernatant.
And then what you are going to do after pouring off the supernatant?
You
had
you
to
How much you are
resuspend
going to leave
the
it? How
you
much you are going to
resuspend
leave it?
Send those.
1 millimeter.
Yeah, 1 ml.
Milliliter.
Okay, and then 1 ml, and then what you are going to do?
you resuspend the sediment. You shake it
Yeah.
to resuspend the sediment. Then you
Mix
take out the
gently.
quantity.
Smear.
Yes, for
Take a
the
drop
Give
and
it
put
to-
over
the
where?
slide.
Put over the cover. Put over the cover slip.
You put on the slide,
Put the
just
slide.
a
Slide.
slide. Then you
Cover
Okay, and
sleeve.
then cover slip.
Put a
Okay.
cover sleeve and then.
Okay. Good. I made you guys too confused, right? Too bad. When multiplying 3.22 times 1.2, how many significant digits should be the result content? You guys do calculation and then see the result, and then you can write out how many significant digits should be the result. Okay.
Okay.
So that you know. Okay. Yeah. Just I'm giving the example how it may questions come. A sample is drawn to test for a complete blood count. What colored blood tube would be collected and what is the anticoagulant present? Binas. Yes, Binas. Which complete blood count, which color tube we are going to collect and what is the anticoagulant in it? Try, you know. For complete blood count or CBC, what blood color tube you use or what the anticoagulant you use? You know that?
ED. Yeah,
Yeah.
EDT.
And what is
Yeah.
the color of the tube?
Lavender.
Lavender. So what is going to be the answer here?
It's B.
Good. Be confident. You know that. Okay. What is the prime? Is anybody telling ma'am to me?
He is disturbing me.
Who? Your son?
Yeah.
Hello. Don't disturb mom today, okay? Okay. After this week, mom is going to be free and it's going to be yours. Okay, sweetheart? Okay. Goodbye. Okay. What is the primary purpose of a provincial regulatory college?
This is B.
Letter B.
To monitor lab professions and protect the public.
Yes. Yes, it's boy.
To
Okay.
monitor.
Everybody agrees, right? Okay. 1 liter of 10% solution of bleach is required. How much 50% bleach solution would be needed to make the, what formula you are going to use it here? Weight by volume or V by volume?
C1V1.
V1 volume by volume is called the volume by volume, volume over volume. V1, V2, yeah, okay. Concentration V1, C1, V2, C2, right? Okay. You will be able to calculate that one, right? So there will be a lot of math questions, standard deviation questions. While removing plasma from the packed cell, red blood cells enter the transfer pipe. Yes, ma'am?
Sorry. Go ahead.
No, tell me, what was your question?
I have a question. Is this for Thursday or for tomorrow?
This is the pile up of everything. There is no difference between Thursday and Friday because all modules are covered. Some questions may come in the first one, and some questions, same questions may come in the part 2, or it's going to be random questions but different. That's why I cannot do a separate review for the part 1 or part 2 because it's covered for everything. That's why I try to cover almost all the chapters, whatever I have. Okay? I try.
Okay, thanks, miss.
Okay. What?
No.
These are already through
No, I don't think
different
she did.
reviews and other things is done. Already in your system. I am just picked up from different places just to ask you the question.
Okay.
It's not I am creating anything new. It's I just for your refresher, I just picked up from different places. You know, different modules, different chapters, different reviews, whatever, and just I bring it here so that just to refresh yourself, just to make sure how much you are ready for the exam.
Okay.
Okay. While removing plasma from a packed cells, red blood cells enter the transfer pipette. What is the next procedural step that should be taken?
A or maybe B.
No, I think it's C.
Yeah.
You discard that pipette and use a new one to continue the, or you just let it be. For that particular situation,
if-
C.
No,
If
we
the-
need to use another tube and recentrifuge.
I have to recentrifuge
In this question with the options is C. There's no recentrifugation of this thing. This one says you should pour it back into the tube and recentrifuge.
There is the option of the centrifuge. You are not going to throw the plasma.
No, but because the disposable pipette has the RBCs in it while we are removing the plasma. So I think it's letter A. Return the plasma to the tube and respin.
Yeah. Generally, they made a mistake. You are not going to return the same tube.
Yes.
Generally, what you do,
Yes,
we
it's
transfer
supposed to
it
be
in a
an
new
obvious
tube,
one, but
and
Yes.
then you
that's why I
respin. Then you
choose
respin it. Then you
Yes.
respin it. But here they made a
That's
mistake.
right.
It should not be returned to the
Yes.
plasma cell mixture to the blood.
That's why I
But here
chose
is the only option is the respin is A.
That's right, ma'am.
Yes.
The letter A. We have to respin the sample.
Yeah. Because we don't know how much plasma you have taken out in the disposable pipette, right? So if you
Yes.
just throw
so
out
it
the
might be
whole,
the
the
last
plasma is going to
quantity.
go totally waste.
Exactly.
Yeah.
Right.
So that is the best option for the respin, or allow the specimen to stand upright for 30 minutes because
30
plasma
minutes,
plasma can be settled down by that time. But it's always better to do the centrifugation. So my option best is respin.
Yeah.
Okay. Reagent preparation instructions say add 3450 microliter of distilled water to a mixture. How much milliliters is this?
3.45 milliliter.
It doesn't look like only Amina knows. Nobody knows.
1,000 because, yeah,
Okay.
1 ml is 1,000 microliters.
3.45. 3.4.
Okay.
That's right.
Hey.
3.45, ma'am.
You guys sure?
Yes,
Yes.
ma'am.
Yeah.
Yes.
which is not a type of Romanesque stain.
Grunwald.
D.
D.
Ray Grunwald.
What is the quantitative quality control data from analyzer documented so trends and random errors are visible to the MLT?
Levi Jennings.
Levi
Jennings.
Ending
Levi
chart.
Jennings chart.
Mitohematocracy is generally centrifuge for
5 minutes.
5 minutes.
8 minutes.
what is an example implied consent? Patients answer to their
When the
name in
patient
waiting
extends
room.
Their arm.
Extend their arms. C.
Okay, that is the implied consent. Good. What is the purpose of susceptibility testing for cultured specimen in microbiology?
Is the antibiotic
Antibiotic. That's best matches. Most effective.
Which one?
The most effective, letter C.
D. C. The
Yeah.
most
C? Okay,
effective.
good. What is the difference between plasma and serum?
Serum
coagulation.
doesn't have the coagulating factors
Yes.
because it has been
Plasma
used.
still
Plasma still has the
Letter D.
coagulating factors.
Everybody!
D.
Yes, letter D.
Plasma
Luis cannot
coagulation
understand the
factors.
question.
Letter D.
D.
What about Chris? What about Fasado? What about Joanna? You are answering? Raise your voice. You are still having the sore throat. How is your sore throat? Better?
No,
A little bit.
Hmm?
I don't know. I'm still taking the lozenges.
Hmm. Okay. Try. Tomorrow you have to the mask then if you have the sore throat. Sorry. If antibiotics are taken by the patient prior to the collection of the urine specimen for culture, what may occur?
Negative result.
Negative result.
Exactly. What is the first step to take if the phlebotomist notices a hospital patient is not wearing an IED wristband?
Nurse or family member. Identify the patient.
Letter A.
No, that
B.
is not sufficient.
Notify the physician the collection will be
Family member is not sufficient.
cancelled.
Oh, wait.
Notify the physician.
It has to be letter B, ma'am. Go to
B.
the
Yeah,
nurse.
go to the
because the
nurse's
nurse will know.
station.
Yes, to replace. Yes, family
And
member is
request
not
a band,
sufficient.
They will be able to identify.
Nurse will be able to identify the
Yeah,
patient.
the nurse who is dealing with the patient would know.
To replace the band.
Right.
There is no replace. There is no band. Who is going to replace it?
It will be
There
the
is no
nurse, ma'am.
there is no chance of replacement. From where you have got the terminology replacement? That I
It
don't
doesn't say
understand.
replace. It says to be replaced.
Yes. So you have to go to the nurse station and request a wristband to be placed on the patient.
Right.
B.
Yes,
How
that's
much? Yeah. How much 40 degrees centigrade in Fahrenheit? You have the formula, calculate it, and you are going to do that, right? You know the formula. Okay. What is the fixative used for cytological, non-gynecological specimen?
Cytospray?
Cytospray.
I guess so.
No, it is, miss. I read that.
Yes. I know. I'm just saying. I guess so.
Cytology.
But then the 95% ethanol is the basic cytologist fixative.
So which one?
But for scraping, it's the cytospray.
We immediately fix it with the cytospray.
The cytospray is 95% methanol.
Exactly. To me, it's the same thing
Exactly.
because
Exactly.
cytospray
You
is also
see the difference?
95%.
That's why I'm waiting.
Yes.
That's why I'm waiting the answer.
because
You
I'm
have to
looking, it's
read
the
the
same thing.
questions.
Oh.
It's 95% methanol,
Methanol.
not
Yeah.
ethanol.
Not ethanol. Yes.
Meta.
Thank you. Who catch it, Amina?
Me.
No.
You?
Yusra.
Good. Good.
Yes,
Very good, Yusra. Very good. So you can see what is the importance in reading the questions carefully.
Yeah.
It is one. You guys like to go away or you like to carry or
So
what?
which is the answer, miss?
Cytospace.
Cytospace.
Okay, that's what I thought, because I read that, the cytospace. Okay, good.
This one now. I'm going to
We
go
will
on.
stay, ma'am. We will stay.
You will stay?
Yes. We're gonna
If you're
finish
okay
it.
with that, ma'am, if you're okay.
Yeah.
I'm going to charge $50 extra per hour for everyone.
That's okay.
We all can put in $2 together. It'll come out to 50.
Then I will send you invoice how many times I stayed long with you guys. I'm going to send a big invoice to your group.
We'd rather give you the 100 than give it directly to Anderson.
What? What?
We'll give you the 100 instead of Anderson directly.
Honestly, I'd rather do that. I'd rather give Miss Moon Moon the 100. I'm not gonna lie.
You deserve it more.
This is I'm joking. Don't take it serious.
I know.
Yes.
Yes, ma'am. Thank you.
Yeah, I'm just joking. Anderson doesn't pay me how much I work for them, for the students, but
I believe you. I believe you.
Yes,
you can see
I
what
believe.
time I'm sending you the emails and this and that. I'm working on it.
that's true,
Yeah.
ma'am.
Yeah, yesterday till 3 I also do the housework, this and that, everything managing. I started working and then I send you those things yesterday. Anyway, go ahead. If the employee's responsibility to ensure there is an SDS available to access for everyone who will be working with the chemicals in lab.
employer's responsibility.
Employer's
Employer,
responsibility.
yeah.
Yeah.
That's what that's.
That is the employer's responsibility, right? Yeah.
Yes.
What is the primary difference between gram-positive and gram-negative bacteria in regard to the gram stain?
I think
Gram-positive has a thick cell
I
wall
think
and stains blue
gram-positive has thick
C.
wall.
Letter C.
C.
Thick
Let us see.
cells.
Let us say thick cell wall. What is the name of the cell wall? Peptidoglycan layer. And peptidoglycan layer, when it can stain, keep the stains, when it has what?
Teichoic acid.
Teichoic acid. So even the gram-negative bacteria, even they have a
They also
thin
have
peptidoglycan,
Yeah.
thin, but they cannot keep the stain because on the peptidoglycan layer, they doesn't have the teichoic acid. So teichoic acid acts as a bridge. Okay?
Yes.
Okay. What is the most important specimen integrity issue to consider when loading a coagulation analyzer with the specimen?
It's either A or D.
Coagulation analyzer.
It's a coagulation analyzer.
Yeah.
90% full,
90% full.
because that's 1
Right.
to 9. So that's B.
Letter
B.
B.
Yeah,
Yes,
B.
1:9.
least
So
1:9.
light blue tube should be 90% full. Otherwise,
Yes.
it's going to reject it. So how the question came is a little bit tricky way. They ask you the question,
Yes.
right? So
Yes,
that you have to
Yeah,
remember is that you have to first consider is a coagulation analyzer. Coagulation means is we are drawing in the light blue.
Blue.
And
Yes.
light blue
Right.
has to be filled 90%.
Yes.
So how the question comes is a language, how they present is. Buffers are made up of mixture of
I think it's true. Weak acid and base and its salt.
Yes. Weak acid. And
hello ma'am. Are you going to come to exam tomorrow? Yes. Okay. I'm going to put you in place of your mom. Reactive substances.
May explode.
All are correct.
all
All
are
are
correct.
All are
correct.
correct.
Okay.
All are
Yeah.
correct.
Serious burns and poisonous. Yeah, all are correct, ma'am, I think.
What do you mean based about empathy?
There B.
Letter
Understand.
B.
A.
B.
Very strong
B.
feeling.
Share feelings.
A.
B. Letter B.
Letter
Ability
B.
to understand.
Yeah, B.
B.
Empathy.
A.
A.
It's A.
I think it's letter A
Yeah.
Yeah, it's A.
The feeling of sincere
because
concern.
letter D is a sympathy.
Because shared, you are not sharing, right? To
Yeah,
the of another. So it's a
Mhm.
Yes, it's letter A.
confidentiality, the ability to
Yeah.
understand and
and
share
share
the
the
feelings
feeling
of
of
another.
something.
Share the
The letter
feelings of
A.
another, to understand and share the feelings of another. It's a little bit tricky if they put the, but to
Yeah.
me, it's feeling concerned of someone who is experienced something difficult or
it's A.
painful. To me, it's
Yeah,
more
that's letter
best.
A.
Yeah. Yeah, after making a blood smear, you find it's too thick. What could be the cause of this issue?
A.
Letter
Too
A.
large.
A, too large a blood drop.
Yeah, you made that last drop. That's why you know Louis, right? Exactly. I know you. Okay. What statement is true about blood culture collection? Blood culture collection.
A.
C.
A.
A, I think.
Oh, yeah.
Yeah,
So
A.
there will be two
It's
sets.
A.
That,
Two sets. Letter.
two sets.
None of them.
A.
Yeah, I
It
don't
is true
think.
now.
No,
One
it's not
set
letter C.
includes
Same
aerobic and
location.
anaerobic, and it is collected from the same
Same.
location. That is
The
true.
best answer is
That
A.
is the best
A.
answer
Yes.
is A.
Answer is A.
Because one
Letter A.
anaerobic
That
and
it is only
aerobic
one set that you
both are
collect, but
collecting
it
from
says
one
Blood
one
culture.
set.
set
One set is
contains this.
collecting
So
from
it's A.
one same location. Yes.
Yeah.
How does the MLT proceed when there is an isolation sign on a patient's door?
Letter D.
Okay. What
D.
must be done before operating a centrifuge blood tube?
Before operating.
Balance.
Balance the
Balance.
load.
C.
C.
Yes, balance the load.
Please and thank you. Don't break the centrifuge in the final exam. Which statement is true regarding compressed gas?
It will explode.
D or
A.
Secure file.
Yeah, A. Secure
A.
firmly by laying down and anchoring
Laying
to the
down on
floor.
the floor.
I thought you had to store them vertically, not horizontally.
It's supposed to be vertical. I think it's
Yeah.
I think
I
it's
think it's
letter
B
D.
as well.
safety
Store
Because
valve
if you
safely
store it
valve
vertically, yeah.
with
without
with
regulator.
the
That means it
regulator.
is. Yes, that means
Yes, letter
it's not
D.
set to start to be used. So the regulator should be off and the safety valve should
Yes,
be on.
that's letter
Yes,
D.
store with
C.
safety valve cap, not with the regulator. Because
Yes.
if you have the regulator, anybody can on and off. So you have to close
Exactly.
with the
That means
safety
it's
valve.
ready to be used.
And
Yes, ma'am.
compressed gas cylinders are always kept from stayed vertical.
Yes.
Vertical, yes, I remember that.
Yes, ma'am.
You
Vertical.
can see the oxygen cylinders and everything in the hospital or anywhere they keep it in stand vertical.
Yeah.
But it's not a function of the charcoal. The charcoal transport media swab.
Letter A.
Not
Yeah.
a function.
No, it is the
Letter-
charcoal is a nutritive media.
Neutralized by the
Yes.
Yes.
So
I'm not
what
sure
nutrients
about
to
the
contribute for the
ultraviolet
blood?
light. I know it definitely neutralizes toxins.
But it's
Okay,
not.
let me go out
What
from
is
the
it?
day course. Otherwise, they are going to shout on me.
Fatty acids. Can fatty acids be
C.
toxic to microbes? Great.
Hi, Christiana. We're still waiting for you. We're still in class.
You guys are still in class?
We're still in class.
He doesn't care.
Yeah. Can you?
Okay, going to the next question. Okay, you guys figured it out. What is the first line of defense for the body against pathogens?
The skin.
Skin and mucous membranes.
Yeah.
Yes.
B.
Letter
Okay,
B.
in the open body passages.
Yes, ma'am.
Royal blue color tube is used to collect the trace elements. True or false?
True.
Venus.
True.
You know what is royal blue? Venus? Deep blue. Okay? It's not the light blue. It is
Ma'am.
used to.
Miss,
Yes.
can I say something, please? Christiana says she still is unable to log on.
But her problem is solved. I don't know what.
Okay.
Whatever they told me, I don't know. She has to communicate. So mostly done. So it's okay. I'll send you this one so that you guys can have a look.
Okay. Thank you, Mom.
Thank you,
Yes, ma'am.
Miss.
So,
Thank
yeah.
you.
Thank you so much, man.
Yeah.
Yeah.
Which of the following?
Okay.
Technique is applied.
This is the last page. Then I'm going to send this one to you guys. Do you need this one, or you already answered this question? You doesn't need it, right?
We need it, ma'am.
We need
How
Mom.
you need it? You already answered this question. You
I
guys
mean,
doesn't
Miss,
need
having it would
But
be
we want to
Review.
do it
For
again.
our
it would be nice to read
self-review.
over, Miss. Yes.
Yeah.
What?
We
Yes,
want to
Miss.
do
Can
it
we have
again
it,
by
please?
ourselves.
Yes,
It would be
Miss.
nice to.
No,
Louis doesn't need it.
Yeah.
Louis, she's talking about the
We need it,
questions of the
Louis. If
old.
you don't need it, it's fine.
Yeah, I need it.
So Luis doesn't need it. Luis is going to get 100% then,
Yes, ma'am.
right, Luis? And he only. No, that is not going to come only. It's everything is included. Why you are thinking only what you know? You have to know everything when you are completing this course. But I don't know why you are this type of things right now. You did very well at the beginning. I know you are going through a lot of stress, but basically you used to do very good. Suddenly, what happened to you? I don't know.
Girlfriend.
I know she is going a lot of stress. I understand. Okay, so this is the last question, and then I will send you later. Which of the following techniques is part of a proper allocating of specimens in the lab?
Sorry, could you repeat the question?
Which of the following techniques is part of a proper allocating of specimen in the lab?
D?
It's D. D.
No, it says after. Label the tubes. It has to be
letter
labeled
C.
before.
It's D.
B.
C.
C. Immediately cover the
Yes,
tubes with
C.
parafilm or cup
With
after
parental cup
transfer.
after.
Yes, letter C.
Yeah, see.
Yes.
Yeah, the labeling is before we transfer the sample.
Right, right.
Which of the following technique is applied?
Part of proper allocating specimen in the proper allocating. So allocate means you have to put the samples in an allocate tube and
Yeah,
immediately
letter B.
cap,
B?
right?
Oh, so it's B.
It looks like that. Allocating technique means you have to pour the plasma in a tube, right? Allocate tube, and then you have to cap it,
Mhm.
right?
Yes, ma'am.
Okay, so list 3 layers of heart from outside to inside. Outside to inside.
Letter D.
Last one. D.
Pericardium,
Myocardium,
and endo. D.
Yep.
Okay. So far, I became able to do this. I'll send you whatever I can. If it's helpful for you, you all answered the question, so I think it looks like you guys know the answers. Still think about that. Do you need this one?
Yes,
Yes,
Mom.
Miss.
Yes, ma'am.
Please, thank you.
Thank you, Miss.
So for today's note, I'm going to charge.
That's
What is-
okay.
What is my
How
charge?
much you
know.
charging, Miss?
Take a guess. What is going to be my charge? What I'm asking for you guys.
Pass.
100 marks.
Pass.
Pass the
Good mark.
exam.
Good mark.
Exactly.
Get good marks.
Exactly. You got it. Okay.
Yes, ma'am.
Thank you, Miss. I appreciate it.
Thank you.
Okay. See you tomorrow
See you
Nine.
tomorrow, ma'am.
In school,
in school.
Take care, man.
Oh,
on
ASNet.
campus.
ASNet and for everyone, just let me tell you, I don't know who is not here. I cannot communicate. You guys can communicate in WhatsApp. Tomorrow, you are going to do the exam. After exam, you guys can leave, okay? Because the day after, you have the exam. But
Yes, miss.
on Friday, after the exam, okay, you are coming back to the lab, okay?
Okay.
Yes, ma'am.
Just check your lab notebook because you doesn't have any time anymore, right? So that's why go to the after your exam. Whoever done early, you can take a quick break. You can go back to the lab. Saina is going to be there, or is nobody? Maybe nobody is going to be there, but you can do your lab books and other things, right? And even you can help me doing the books. After the exam is over, you guys can come to me. I can that books what I have to do, you know, the skill books. I can
Yes.
upgrade it, sign it, so it's going to be mostly complete for everyone. And
So
then
this,
more.
That's for
Yes.
the Wednesday.
so
Wednesday,
so
you guys
Right.
go up. Wednesday, you do the exam and go home for the second part of theory. Okay?
and Friday we come in and do the exam and then stay
Stay
Yes.
until 1 o'clock.
until 1 o'clock. That is your class time.
Okay. Okay.
Okay? And then the following Monday, you are going to come to the class from 9 to 1. If you need a little bit extra time, it's okay. I don't know how much is my work. Then from Tuesday, Wednesday, and Thursday, you guys in group, you have the final exams, right? Practical. Am I
Mm.
right?
Yes.
Everybody
Yes.
understand? Okay. But
Yes,
then
ma'am.
Friday, this is the rule. You have to be, everyone has to be on the class. It's okay, Santiago, you have doctor's appointment. When you able to come?
So what my doc, it's over a Zoom meeting. He said he'll meet with me anywhere between 9:30 and 10:30, although it's most likely going to be closer to 9:30. After that, I'll come to class. It shouldn't take long. It should only be like a 10-15 minute call. And that's about it.
Is that a Zoom call, or you have to take your doctor to the doctor?
No, it's a Zoom call. So I was thinking I could maybe like step out for a sec.
That's the better thing. You can come,
Yeah.
okay, and then we have the
Mhm.
meeting. You can go
Yeah.
out and do the meeting and come back. That's why you are safe. We are safe. Okay.
Yeah, for sure. For
Last
sure.
date
man.
attendance. That's what I'm just telling. And everyone just write it in the WhatsApp group and other things. Friday we have to be there. Nobody can miss that one. Okay.
Yeah.
Okay, miss.
Okay, ma'am.
If you miss
so-
it, you will miss something. That's I'm just telling. You will miss something because I have to hand over you something for your next steps. If you cannot come, you are not going to get that one from me because I am going to be get on Thursday evening after the class.
Yes, ma'am.
Okay, ma'am.
Okay, they will tell you to hand over me some of your papers or something. I cannot do it until the final exam is done. So when it's done, they are going to give me the packets, and then I'm going to give it to. I'll try to complete the exam things. We'll see, and we'll do that. So Friday you have to be there. Okay, there is no excuse. Okay.
Okay. Miss,
Okay.
Okay, ma'am.
Miss,
Yes.
can I ask a question, please?
Yes.
So
Please,
you're
sure.
saying that this Friday we're there until 1 o'clock. This Friday
Yes.
after the exam,
Yes.
and then Monday we're coming back on campus.
Yes.
Mm-hmm.
That you are going to do your revision.
Okay, so Monday until
You
1.
just do the poke, you do the mitohematokit, you do the ESR, you do the slide, you do the cytology, histology, whatever you have
From
learned.
Monday until 1.
Yeah,
and then
you
we
don't
do
have to do
our
the
individual
ECG. I told them it's going to be too much for doing the ECG. It's going to be too much chaos. I don't think they are going to incorporate it. But till you guys know how to do the ECG if the question comes.
Yeah.
That's why make you small groups.
Well, thank
That's
you,
just-
ma'am. Yes, that's the one. The
Okay, ma'am.
ECG room.
Yeah. No, that's I told them, and
Yeah.
that's why they told me you make a small groups. I said you did them a small group. That's why I did break it into 3 groups. They asked me to do minimum 10. I said no. We don't have the facility to do the 10 at the same time, and one over another,
Exactly.
fighting for
ma'am.
the
Yeah.
centrifuge, fighting for
True.
this, fighting for that. Is So
And
be
we have,
on time. Be on time. Okay.
yes, ma'am. And we have
Okay.
also to do the all those ESR hematocrits, differential count, gram
Slide
staining.
staining, gram stain,
Exactly, ma'am.
new milk
So
clean blue stain, your what
yeah,
is called the
reticulocyte
reticulocyte.
and urinalysis.
Oh no. Gyms are white for the blood cells. Yeah. Not only the
Yeah,
WBC, yeah, that is the stain. Differential staining, you have to do.
right.
Which one is going to come? You don't know how to separate plasma, see them, write it down properly, allocating, seek the T1 ESR. Remember the normal values for the males and females for everything. You know, you have the experience, one experience you have in the midterm, right?
Yes.
So right now, don't think about that. What I am telling regarding the practical, don't think about that. Do the theory part first. Then from Friday, after the exam, you are going to start up thinking about this one.
Yes, miss.
That's
Thank
right.
you.
Thank
Yeah.
you.
Ma'am, so tomorrow is
Friday.
ununiformed or uniform?
Yeah,
Or anybody in the
uniform.
lab, always be on the uniform, because otherwise Badil is going to drop you out from the campus.
So Wednesday and Friday, when we do our theoretical, we should come in our scrubs. Okay.
Anytime you guys at Anderson, you have to be in uniform.
Yep. Ask us Binas. Binas, are you there? Where is Binas?
Yes, ma'am.
If he doesn't wear the uniform, what he should do?
Go home.
Sent home.
Plain and straight.
Yeah.
It happened before. Somebody came from the Hamilton. He sent home immediately.
Yeah.
1 o'clock
And
on
that's at
Friday.
the beginning, not only even in the middle. He's very strict.
He is strict about the rules.
All the rules. He's very strict.
Yeah.
No, I was so scared to do a test right in front of him.
You did?
Yeah, I was sitting right in front of Bardo because it was just me and him.
Oh my God. He was proctoring you. He has no class that day?
No, ma'am, he was sitting right behind me. He was watching my entire screen
Oh my God.
the whole time. I was like, oh my
Oh
God.
my God.
It
I
was
don't feel good if somebody can proctor me, but I don't feel if somebody is just on back of me non-stop.
I know that's why I was
That's
like, I kept looking behind.
the professionalism. Proctorship is not like that, being sitting on the back. Proctorship is your eyes and mind should be very clear, and from the face and from the activity, I can understand who is doing what.
Yeah. No, but I was just like, is everything okay? He's like, yes, you just continue. Look at your screen. I said, okay.
Huh.
It
Anyway,
was, yeah,
okay.
very
So tomorrow
dramatic.
I'll be there. Be nice. Be on time. I am telling you, tomorrow I'll be very strict. If you doesn't reach there by 9:10, I am going to close the door.
And go home.
I am going to close the door.
Okay.
Because then you have to keep your things, you have to log on, you have to take a deep breath, you have to put your phones and other things there. I need you to stay calm instead of rushing, coming at 9:15. This, that, others got distracted too. You have to think of the others too. Okay?
So the exam is 9:30.
9:30. Before that, 9:20, everybody will be on sit.
That's right. Yes, miss.
Open, lockdown browser is going to be open. Wait, I will give the password, exam start. 5 minutes, you are going to do nothing, just deep breath, calm yourself.
Okay.
Okay. Good luck to everyone.
Thank you, miss.
Thank you. Thank you, ma'am.
Only 3 more days online.
I know.
Thank you so much, ma'am.
Thank
For
you.
what? I just yelled on you guys. I didn't do anything.
No, you did a lot. Thank you.
You guys can write a note. After that, you guys can write evaluation note and send it to Bardal or Rajiv or Kim, whatever may be, regarding me.
Yes, we write a very long note saying we appreciate you.
A positive.
Yes, ma'am.
What?
I say write a
Positive
long note
note.
telling them how much we appreciate you.
Oh,
Yeah,
no.
positive
I
note,
did not
yeah.
know that. Yeah. But anyway, study.
And we are also a little bit special because we are the last batch that mom will be teaching. That's something else
Oh.
too.
For now,
She's
for
not-
now,
For now,
before
not-
change. For
oh,
now, I
okay.
will think about later because right now, because for my
Yes,
knee
ma'am.
and surgery and other things, I don't like to. I may help them little